Hello. We are back in Siemianówka. It's been a few days after I came back from the surgery. Most of you who watch that are probably consider going for a surgery, most likely. So I thought that maybe it will be useful for some to do a video where I show what I packed to the bag that I took with myself to the hospital, and showing that perhaps will help to prepare for people. Maybe when we will get over a few things, we'll be able to touch a few very important topics regarding the open heart surgery. And this way, maybe some of you will feel a bit more confident about the experience overall. Let's take those things out one by one and let's talk about those a bit. And obviously I already got rid of the dirty clothes and pajamas. Pyjama. Get yourself shirts with buttons to allow for better access to the scar, to the site of the surgery. It will save you a lot of time and struggle. So that's first advice. Here in this little bag we have few things. I have few things that helped me with the most important thing, that which is sleep. Nothing is more important in the hospital that you can do, that you can take care of, that will help with your regeneration, that will help you to get out of the hospital as fast as possible, as sleep. What I noticed is that after each period of sleeping, either it was the whole night or maybe a nap, after each cycle I felt better, and sometimes the improvement was even hard to believe. There was no exercise, there was no food, there was no supplement that I was using that was helping me more than 8 hours of uninterrupted sleep. And unfortunately, there are few things in the hospital that are quite challenging for people who want to have a good night's sleep. First of all is pain. Obviously, pain can wake you up. Thankfully, the painkillers are there, so the pain will not be the main contributor to the sleeping problems, but it could be for some people. For me, it wasn't. For me, it was kind of a restlessness that I was struggling with sometimes. I didn't feel pain. I felt that my body is tensed up, that my mind is racing. That is why a few times I asked for medications to sleep. This thing is extremely useful because it blocks every kind of light that can stimulate your eye. And obviously, even if you have your eyes closed, you know when the day kind of starts, you start to experience brightness, some degree of brightness, which already can trigger some production of cortisol in the morning, which is a normal situation because this is how our body is wired. We're supposed to have some cortisol production in the morning, so it would wake us up. But in the hospital setting, you want to sleep as long as possible once you get this sleep, and this helps a lot. Another thing that is really helpful with sleep are those glasses. They block the UV light, so I was using them more or less like this. I know I look kind of silly having two pairs of glasses, but who cares actually? The moment your eyes have contact with blue light, your melatonin production decreases greatly, and it's simply because your brain thinks that it's the morning, because naturally the blue light is present only in the mornings, not in the evenings when we're supposed to be getting ready to sleep. So I use those glasses. I start using those glasses 2 hours before the time when I plan to fall asleep, and I experienced their usefulness multiple times when I was very sleepy. I checked the phone just to see if perhaps my wife needs me or something is happening, or maybe I was waiting for some news. Quick check, and then my will to fall asleep, feeling fatigued, disappears, and I just feel irritated. So that's a good enough reason to have those glasses. They cost like $3, so great investment. Another thing, earplugs, and this is awesome. This is extremely important. You have to get those in your room in the hospital. You will not be alone, most likely. In the majority of the time, you will be with 2-3 people, maybe one. I was with one person, which is awesome, but you may not be lucky enough. And people after heart surgery, they don't breathe very easily very often. Some of them will snore, some of them will make funny noises. Hopefully you will be lucky enough to don't have anyone who is disrespectful, who sits until very late night watching some silly videos. It didn't happen to me. I was having very cool roommates. So, but not everyone are lucky enough. I saw YouTube videos of people struggling with horrible people that they had to deal with. Earplugs can help to at least some extent. Obviously, toothpaste, shampoo, toothbrush, headphones for obvious reasons, shaving stuff, and if you didn't know, you will have to shave everything the day before the surgery. They allowed me to keep my beard. I don't know why, but I was actually very happy about that. But I still had to shave my whole torso, my hips, legs, and everything until forearms. So get yourself ready after shaving the day before the surgery, and a few hours before you will have to have a shower with a special gel they provide. My bulbulator, you could see more about that in the breathing exercises video. Compressive socks, awesome, get those. Just wearing them gives this kind of sense of comfort, sense of relaxation. And this is a 3D model of my heart that was used for the surgery. I got it as a gift from my doctor, and actually I was thinking about doing the whole video about that because it's so awesome how this surgery was prepared, how it was performed. In the shortcut, that's the model of my heart, and that's the chunk of meat they removed. This kind of belt I had to buy for around $30 in the hospital, and it is for the purpose of protecting your chest during coughing. After the surgery, you will cough a bit, and it's because your lungs were turned off for some time, and there is a lot of swelling and there is a lot of inflammation. So obviously you will have some mucus that will have to be removed. The unpleasant part is sometimes you feel that something is there, but it needs some time to mature enough before it will be ready to remove. So sometimes you feel that you have something irritating you for like an hour or two, and then you cough it out, and that's awesome. Then it's great. The belt looks like this. Like when you expect to cough, you squeeze yourself here, and it stabilizes your sternum. And it's very important because you basically have this bone here cut. So we have to stabilize that to avoid any injuries. Actually got myself something very similar, but a bit more elastic, and this is very helpful. It helps me to drive a car even after I shouldn't say about the car. Laptop, I was playing Witcher 3, awesome game, and it really helped me to forget about the whole situation sometimes, which is also important. You cannot think about your problems at all times. What's the point? I was able to play on the 4th day after the surgery. On the 3rd I tried, but very quickly I got migraine, and I just felt that it's very overwhelming still. Cream for skin, another thing that's supposed to help me with my sleep. Those were supposed to dilate your nostrils. Honestly, I didn't use them in the hospital even once. I had so many things to take care of, so many things to think about, that applying this would be already way too much. But I can do it now to show you how those work. Basically, you place those magnets on your nose. I'm not sure if it looked like in the commercial. I'm not even sure it's straight because I did it without a mirror, but it seems like it's working. I feel like I can get a little bit more air. It's not like a game changer. It could potentially improve my sleep performance by a few %, but I can imagine that if someone has a much bigger blockade, then something simple as this may be very helpful. Gummy bears with melatonin, my infrared lamp. What I can say for sure is that this helped me to feel better. I was having a session of 20 minutes every day. In the beginning after the surgery, 24 hours after the surgery, I had the first one. I started with 5 minutes, and then I was increasing up to 20 minutes per day. After each session with this lamp, I felt refreshed. I felt that I didn't feel like I have a second life, but I felt that some bad energy left my body, if that makes sense. I felt lighter. There are studies proving that this works, that the infrared and red light helps with regeneration, but even if there would be none, just the fact that I felt better was worth taking this lamp with myself to the hospital. The base of the pyramid is sleep. Second place is food, the quality of the food, the frequency and quality of the food. The third most important thing are the exercises, is the movement, and this is just like few percent. It doesn't matter that much, but if you are able to get yourself a lamp like this, I would recommend that really. And now the supplements. The first and most important is the protein. In my opinion, majority of the people don't eat enough protein. Proteins are the structures based on amino acids, which are part of the foods that we eat. Some food that we eat is made in majority from proteins, like meat for an example, or fish. Some of the foods, they contain high dose of proteins, like cheese for an example, like eggs. Some type of food, like veggies, they contain only a little bit of proteins. The problem with the diet of majority of the people is that it doesn't contain enough protein. And obviously we don't talk about the severe protein deficiencies in the diet. These days almost no one has this problem taken to this severe extent when it's a disease caused by lack of proteins. But still, majority of the people don't eat enough, and the symptoms of that is that they struggle to maintain or build muscle, and the fat tissue is being stored around the abdomen and around the hips. If you are a person who trains hard in the gym and you cannot push for more progress, even if you eat a lot of calories and you notice that your adipose tissue, your fat tissue is growing, definitely you don't eat enough protein. I highly recommend getting a protein supplement for your stay in the hospital. It will definitely help you to recover faster because your need for proteins is much higher after the surgery like this. I use Huel because the supplements made from the milk products, they don't react well with my stomach. Huel is 100% vegan, but still one portion has 40 grams of protein, and even though it's vegan, it contains all of the amino acids. Vitamin D, one of the most important supplements, holy grail of the supplements. I spent 1 week inside the building. I couldn't leave the building. I'm sure that if I wouldn't have this supplement, this would influence my thinking, my feeling, and my regeneration and my immunity. I recommend to get vitamin D with vitamin K. Rhythmopask is the herbal supplement. Those are drops. They helped me a lot to calm down my nervous system and to regulate my heart rhythm. I know it's homeopathic medicine, but some doses of the herbs that are there are not homeopathic. You can use too much of that and have some side effects, and I am the example of that. Herbs interact with medications. That's why I would recommend to discuss with your doctor if that's the right supplement for you, and start with a very small dose. Probiotics, I got a few doses of antibiotics, and that's a normal practice around the time of the surgery to minimize the risk of infection. Creatine, one of the best supplements ever created. If someone goes to the gym, they definitely know what the creatine is. It's very safe. Our bodies are able to digest up to 20 grams of creatine per day, but even if you would eat a lot of meat, which is the product containing most of the creatine, we can eat maximum 2 grams per day, so we could digest and use much more of it. And the last thing are the peptides. Peptides are the short chains of proteins. I already talked about those. The ones that help me the most likely. Obviously, you take a lot of things in the hospital, you improve day by day, even without any supplements, so it's hard to say how much some of the supplements helped, but I am sure that this one helped me the most, just because of my experience. It's a very subject opinion, so you don't have to take my word. If you watched my previous video, I had few. I will start to use them right now, along with BPC 157, that's the injectable peptide. I consulted that with the doctor, and he actually didn't express any interest in that, and he was 100% right. This is protein, and it's very specialized protein. Your body produces it naturally. The fact that you want to supplement very specific protein, it's counterproductive for majority of the people because of a simple reason. Massive portion of people, they have deficiencies of protein just due to the basic problems with their diet just because they don't eat enough protein. The cost of this package is like the cost of 3 bags of fuel. If you don't take care of your diet and you don't even try to fulfill your basic protein needs from the diet, then buying fuel or any other protein supplement is unnecessary. If you try and you want to upgrade that and to get even more from the proper protein intake, then some of the supplement, but getting some supplement may be helpful. And if you take care of those two, then if you want to add something extra, you can get the peptides like that. I trust this brand. I know how many athletes that I was working with use that and how well it works. That's why I feel comfortable advising that for anyone who would like to enhance their recovery. But honestly, I saw what people eat in the hospital, how people treat their health. If you eat a proper food, if you eat enough proteins from the diet, you are doing better than 85% of people. And if they regenerated from the open heart surgery, you will regenerate as well. If you start to take some protein supplement on top of that, you are better than 99% of people. Then you are like an amazing person who would be a favorite person of every cardiosurgeon. And this one is just for freaks, for people who really want to squeeze everything from the recovery, everything what is possible. Beta blockers, they will stay with me for some time until my heart rhythm would balance. So hopefully I will be able to get rid of them in a few months. And the last thing is the charger for my Whoop. I didn't even have time to write them to figure out some sponsorship. I actually am a small influencer. On my Instagram I have around 6,000 followers, which grants me the possibility to write to some brands that I really like, and they are very often more than happy to provide me with some discount code. That's the benefit of being a micro influencer, and I'm very happy to do it because I share something what is good, what is tested, that I wouldn't feel ashamed being next to, with being associated with. That's why I'm very happy to advise you those peptides, advise you this infrared lamp. Why not? If it's good, why not? And Whoop is actually awesome. Thank you, Wabi, for giving me this gift. This is from one of my patients, and that really helped me during my recovery time. I cannot express how much helpful was to have something that was measuring some of my vitals. First of all, I was wearing that for a few days before the surgery, which gave me some idea what my more or less normal parameters are, what I should strive for. Second of all, the fact that it was measuring my heart rhythm and measuring my saturation allowed me to save a lot of time, because without that I would have to measure that myself. The fact that it measures my heart rhythm throughout the days helps me to notice that it's slowly decreasing, which will help me to regulate the dose of my beta blockers, of course after consultation with my doctor. But having something like this, it's making the process very easy, because everything is just visible, it's just there. It's also very motivating to see that my parameters are getting better over time. And that's it. That was my bag. I hope that it helps someone, and obviously a lot of people who watch that are preparing to have a surgery. So guys, good luck over there. Everything will be fine, nothing to worry about.